That'd be helpful if I got on the screen. Hi, this is Deirdre Vervo. Thank you so much for joining us today on Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. You may know me as the author of the book, Home to Home, the Step-by-Step Housing Guide, where we talk about Continuum of Care. Today, we also have a special guest talking to us about that. Before we start, I wanted to let you know that I'm so happy to say that just like home, our Dogwood Home, our boutique home for 6 seniors with memory care and assisted living needs is just booming, going along swimmingly, loving every minute of it. We're full. We have a waiting list, but still come and see us and visit and tour. Looking for more homes to open up. There's such a demand for these small boutique memory style homes. So if you have a home in Shelton, a nice ranch home, and you want to sell it, please give me a call. I am desperately looking to help more seniors, and I would love to expand. So today we have a very special guest on. We have Danielle Ramos. She has been in the industry, healthcare industry, for more than 20 years. She got her degree in psychology and gerontology from UConn. She's a certified dementia practitioner. She's a community educator. And right now she serves as a director of community relations for the National Healthcare Southern Connecticut Division. So the National Healthcare has more than a dozen locations throughout the state. They do therapy services, home healthcare services, pharmacy, as well as hospice and palliative care. She's going to tell you more about that, as well as continuum of care for your seniors. So without much further ado, we welcome Danielle. How are you, Danielle?
Hey, I'm well. Thank you for having me.
Good. Thank you so much for coming on.
Of course.
So I love what you do, and I know you've been doing it for quite a while, and this is your specialty. How did you actually get into it, even during college? Most people I know started that a little later after working in the field. How did you get into working with seniors and gerontology in college?
Sure. So I honestly kind of fell into this career. I always have loved working with children, babysitting as I was, growing up, a teenager myself, and also always loved the elderly, was very close with my grandmother, just always really had either end of the spectrum I really enjoyed working with. I thought there was so much to learn from both and so much to share. So I started working at a facility in my senior year of high school, actually.
Wow.
Went off to college, stayed working on the weekends, doing reception, and just really enjoyed it. Enjoyed seeing residents, come down to the front and chat and, getting to know family members and talking with them as well. It really is it's like a second home. It's really, it's community, it's family. And so I really never left, finished up, got my degree, ended up throughout all that part-time, ended up becoming full-time working with the recreation department, ended up running the recreation department, which was great just because you brought so much joy and so much quality of life to those living with us, which was excellent. And with recreation, I ended up starting doing some community outreach, going to the local senior centers, things like that. And from there, it kind of just progressed to where I was, out in the community most of the time, sharing what we do, just trying to educate. I do a lot with the Alzheimer's Association as a volunteer educator for them. And so that kind of has brought me to where I am. I still love what I do. Now I'm more externally based, so I'm not in the buildings as often, but I do still make sure to pop in and visit because that's at the heart of all that we do. So, seeing staff, family members, residents, that's the most important thing to me. So, so I fell into it, but it's been wonderful.
That's amazing. So what does Southern Connecticut, National Healthcare Southern Connecticut actually do? Like who's your clientele? Who would come to you and what for?
Of course. So National Healthcare is our parent company. National, as you mentioned, has 13 facilities throughout the state of Connecticut. They have 40 actually within the Northeast. So they go, into New York, states surrounding us. Here in Connecticut, I do cover the southwestern half of the state. So I'm in 6 of our buildings. 2 are in Fairfield, Cambridge, and Ludlow. There is one in Milford Health and Rehab. I also go to our building in Wallingford, which is Regency, and then I venture out toward Bethel Health and Rehab in Bethel, and then Village Crest and New Milford. So bit of a territory that I cover. All of our buildings, all of our buildings provide long-term care, short-term rehabilitation. Some of them have a dedicated memory care. So in the southern half, Regency, Ludlow, and Village Crest all have a dedicated memory care neighborhood. And then we also provide respite care. So for caregivers who need to travel, who just need a breather, need maybe to get a procedure, a medical procedure themselves, that need just a little, whether it's days, weeks, we provide respite care as well.
Nice. Yeah. Excellent. So, I'm in the memory care arena. So if somebody comes in with memory care needs, that needs respite, do you have a special area for them that they are safe from wandering in?
Yes. So, I should say that all of our facilities, all of our buildings can accommodate someone with memory care issues. That said, we have wander guard systems and there are safety measures in place. So someone with a memory impairment can be safe in any of our buildings. However, our buildings that have the dedicated memory care tend to be a better fit for someone, whether it's respite or short-term rehab, just because there's different staffing, programming, all that dimension entails. Those floors are staffed differently. So someone's coming in for short-term or respite would be placed on our memory care neighborhood if that was appropriate for them.
Okay. And as the community relations person going to all these buildings, and you're doing outreach programs, I know you have like a grab and go breakfast going on. What kind of community outreach programs are coming up?
So we like to, every quarter minimum, we like to have, a community event, a professional event. So, we definitely reach out to our professional partners. So that's assisted livings, cares, elder attorneys, senior centers. I like to host fun activities for them. We do lately with COVID, we've been doing more of the grab and goes. Unfortunately, we haven't been able to have some of our bigger events within the facility, but it's still a great way to see people and to share our services. They get to share their services with us. We love to engage with our community. For example, this week coming up, actually this Saturday, Village Crest is going to be at their first annual New Milford Apple Festival. So that's something that's fun. We're going to have a table there just to share info. I mean, we definitely, our number one is to help and to educate. So in this continuum of care, there are so many options. It's for caregivers and loved ones. It's overwhelming. So if we can help, we love to, help. And even if that's not necessarily needing our facility at this point in time, maybe that person can do better at home with home care or in a wonderful home boutique like setting like yours. An independent community and assisted living. We work with our community and we want to do what's best for the person. And there are so many options.
Can I tell you, this is one thing I found like so beautiful about this whole community. I mean, I used to own an advertising agency and then went into real estate. Being in the healthcare field now in Fairfield County, anyway, I don't know if this is everywhere. Everybody's like one big hug. Like everybody is helping each other and helping the community. And it's all about doing right by the person. It's like amazing. I love it. It's like a big really nest.
And it truly is. You think, okay, there are other, there are multiple home cares and multiple facilities. But we really do try to do what's best for the person. I mean, I think, me personally, and I think so many in this field, we're in this field because we want to be in this field, because we want to help. And also we look at it as, that could be my mom, that could be my grandma, that could be my sister, so I would want someone to help me to do what's best for them, not what's going to benefit my facility, what's best for them.
Exactly. And that's what I've come across time and time again. And I put people together and I'm like, I'm sorry, I think you might be competitors. They're like, oh no, we all work for the same goal.
It's a great thing.
That's so cool. So tell us a little bit about the continuum of healthcare, like going from home, independently living to what's next.
Absolutely. So many times, as I said, I mean, our healthcare system right now, it's so broad, it's so confusing. And we will often in skilled nursing get a phone call from a family member, not knowing who we are necessarily, what we do, not knowing the difference between assisted living versus skilled nursing. And so we like to, as simply as possible, kind of walk someone through the progression and the steps that might occur. That said, you can go forward, backward, sideways with these different options. So generally someone who is living at home who finds that, okay, might need a little help maintaining my home. I might need a little help getting myself, up and showered and dressed, or just I need some help managing my medication. I could take it daily, but I can't quite set it up for the week or for the month. Someone like that would benefit from services in the home. So they could remain at home. Home care would assist them. There are options such as companions who are just company, so someone isn't lonely. There are non-medical home cares, which would help with those, more of those, maybe tasks at home. Maybe it's, taking someone out to the grocery store. Then there is medical. So if someone did need more help in terms of managing medication or some other needs, with showering, grooming, things like that. So home with services is your first step after realizing you're not safely independent anymore. From that step, when the person progresses and things are becoming a bit tougher, even with those in-home services, you can increase them. I mean, you can start with once a week to twice a week to 24-hour live-in 7 days a week. So it's really what worked for the person for their finances. But after home care, the next step would generally be assisted living. So that's where someone would have their own apartment. There would be communal dining, communal activities. They provide transportation to doctor's appointments, to outings, to plays, to the movies. So that piece is great for someone who really could benefit from that community feeling, and also just having some help, having someone there. In case. They do provide services that vary with different levels. So you might need, the level 1. I can't speak, as well on assisted living. I know in general I'm not in assisted living, but they do have different levels of care depending on how much that person might need in terms of assistance. After assisted living, when someone's care needs become very great or they become more acute, if someone has to be on a feeding tube, or perhaps they need a catheter to use the bathroom. Maybe they are no longer able to get in and out of bed and transfer themselves. They need the assistance of staffing and also perhaps a type of a special lift that could get them in and out of bed. When needs get very great, someone will generally then come to a skilled nursing facility. We have that 24-hour nursing oversight by both CNAs who are providing that day-to-day feeding, dressing, grooming, by nurses who are helping with medication and some of those advanced care needs. There are supervisors on staff 24/7, nursing directors. So there really is, much more that we can safely do in a skilled nursing facility that someone might progress to and need. So that said, as I said, you can kind of move in and out of those. Someone might go into the hospital for an acute illness or a surgery, and they need to come to skilled nursing because they need that acute rehab. They need that acute nursing care. But they're going to rehab, they're going to get better, they're going to be with us short term, and they're going to go back home. And they might go back home independently. They might go home with some services. They might realize, maybe home isn't the best place for me independently. Let me look into other options in assisted living. Some of those independent living communities are coming out as well, or like your home, which is a smaller entity that someone could move into and have that companionship and that care. So someone might, or they might go from assisted living, back home with home care. There's so many ways that you can move within this continuum. So it's not that you enter at, point A and then you exit at point, Z. It's what works at that time. And like you said, and like we've said, this area is wonderful with people working together. So we really can, if it's someone's goal to be home, even if they're with us long term, there are great programs. There's, the program like Money Follows the Person that could take someone who could manage at home but maybe financially they can't. So they're with skilled nursing, that could help them to then, gain their independence back. So there's so many options available, and it's extremely overwhelming. I think being in the field where, I would sometimes take for granted, I think, what we see and what we know, and how for many others, it's like, wait, what do you mean? What are my options? It's just, they don't have any clue what there is to offer.
Danielle, does your company help them decipher which options are best? Do they also help them with the financial options, or?
Yeah.
Because what options are covered? So Medicaid only covers nursing homes in Connecticut, right?
Correct.
So if you're on Medicare and you need assisted living, private pay.
Assisted living is, yes, primarily private pay. Long-term care insurance will cover, stays with assisted livings. Skilled nursing, we really can accept, depending on the facility. Some have different contracts with different, insurances, but generally, yes, Medicare will kick in if someone has been hospitalized. They have a short-term benefit for Medicare stay. Secondary insurances, commercial insurances, Blue Cross Blue Shield, those insurance policies we accept. Again, those sometimes from building to building may differ depending on who has a contract with which company. Yes, Medicaid is something that mostly it's skilled nursing that is going to accept that. So that's when funds are exhausted, someone has to apply for that, and then they could live out the remainder of their life with us in our facility. What else is there? Long-term care insurance I mentioned.
Yeah, I think that's very tricky. So,
yes.
I mean, I have a cousin who is pretty young, and she's just about to get onto Medicare.
Mm-hmm.
She's like, I don't know how people do this if they're older and have to figure out the 22 supplements or whatever the plans are. She's like, I can't figure out what things are paid and what things aren't paid. And, she's 61 years old. So she's like, how do people do this when they're older? I said, I think
yes.
help them.
Yes, honestly, yes. So, we are there to help. Like I said, we get so many calls of people just calling blindly saying, I need help and I don't know what help I need. So like I just explained, hey, these are some options. That's what we would tell to that person. We would give them resources in town. If they said, hey, I think assisted living, sounds right for me, we would give them local contacts who we have. Same with home care, but we do encourage, this is something that you really need to think about and plan for in advance, because in crisis, it definitely is even more difficult because, crisis situations, you don't really know what your options are. When it comes to payment and things like that, it can get very, very stressful. So knowing, okay, yes, I've got the option of home care. I've got, assisted living, long-term care. I encourage people now, no matter what age you are, stop by these places, call them, drop in. Our doors are always open. I encourage stopping in. Now with COVID, it is a little bit tougher, so maybe I shouldn't say that. But in the past, we would say just stop in, when you can really see how we're functioning and what's happening in the building, where you can observe activities and, interactions between staff and residents, because it is important to know what's available to you. And then how is that in terms of funding? Is that an option for you? Is that not? Of course, there are resources like elder attorneys. There are, like senior planning services is one of the services that can help you apply for that team.
Geriatric social workers.
Geriatric care managers. They have a new name now. I forget their official name, but they're exceptional just because they know all of these resources as well. It's a tough process to do alone, honestly. It's very tough.
What I'm finding a lot is people in their late 80s or early 90s. It's one spouse. Not one spouse is left. There's, a married couple and one spouse needs care and the other doesn't. And can the other one stay in their home and put the other one into assisted living or memory care, or it's just too tough to keep them in their home anymore. And it's just like, it's like heartbreaking. Tell me a little bit about the Money Follows the Person program.
There are a few. That's a government program. There are multiple government programs. SWACA is a great resource, Southwestern Connecticut Agency on Aging, just to find out what programs are potentially available. Something like Money Follows the Person. Again, that's someone who doesn't have the funding, doesn't have the funds to stay home with the care that they need. But they're also a person who could be who doesn't necessarily need the 24-hour skilled nursing like our setting. So that's a program that would provide them with an apartment, with a caregiver, with a companion in home, so they could be a member, of the community. Because perhaps physically they need some help, that they need to be they're in a skilled setting, but maybe cognitively they don't need that, or they could benefit from being independent. They're still able to function. There's a program. There's a caregiver respite program. I mean, those are great things to look into for caregivers. It's a daunting task day in and day out, and so many caregivers do this and risk burnout because of course, I mean, it's our loved one, it's our family member, we're going to do whatever we need to do, but we also try to remind those caregivers that you can't care for someone else if you're running on empty, if you're not caring for yourself. So programs like the respite program would be good for someone, just to give them a couple hours of help at home. So maybe they can go out to lunch with a friend, they can go get their hair done, something that would just kind of fuel them back up and allow them to keep being that primary caregiver. So there's a lot, again, with that aspect, there's a lot out there. Organizations like SWACA I find are beneficial just because they know those programs. Geriatric care managers, again, know a lot of what's out there and what's available. So certainly certainly look for the help and take the help that's out there. And someone calling into us, that's why I kind of say, even though we're the skilled nursing component, the rehab component, being in this field, you're versed enough to know, hey, you could benefit from this, let me give you that contact. And that's again, that's part of what we do, just trying to make sure we're helping that person, even if it's not with us.
Yeah, this is pretty complicated to know what to do when somebody is either mentally not there, physically not there, or both,
Mm-hmm.
or or gets sick, or gets
Right.
hurt, or it's just, yeah. I had a friend whose dad was 82, but he was still running an accounting firm
Mm-hmm.
in Long Island, and all of a sudden he couldn't function anymore. And my girlfriend had no idea what his finances were, his expenses. He was totally independent, and they had to quickly do something. They sent him to Vermont near the sister because it was less expensive there, and then they had to go through all his finances and figure they had no clue. And he didn't want his household, and he actually, my girlfriend said, if you can make yourself back to your home and get your own caregiver, if you're lucid enough, you could do that. And he did. He got home. But it's just, it was overwhelming, especially if you don't live near your parents and they're not sharing their financial information with you. They're not sharing what they have set up, or they don't want to talk about it. I have one that doesn't want to talk about it. That's a tough situation, because it's inevitable, so we need to talk about it. But
right, I think it's definitely a difficult conversation, and some people just don't even want to think about that, and so they don't think about it, and they don't talk about it, and then they find themselves in a difficult position, or their family is left in a difficult position. That's why it's so important to talk about that. I mean, me being younger and being in this field for so long, I ask my parents questions all the time. And, my mom is, how could you ask these? How, why do you think about these things?
I need to know.
I do, I ask about their living wills, and I ask about things like that. And she just, my dad's like, yeah, he's good to talk about it. My mom is just like, no, this is terrible. I can't talk about this, but we have to. I'm like, Mom, we have to. This is really important.
I think that a lot of people don't know what they don't know. So I have a neighbor whose mother is in her mid-90s living with them, and she really needs nursing care. But what happened is she would be eligible for Medicaid, except she inherited $200,000 3 years ago and gave half away to her kids.
Okay.
And now, 2.5 years ago.
Yes.
And the rest, she was living on, and she still has some left. But now she's ineligible for the 5-year look back at Medicaid. And she was just living in an apartment, she would have been totally eligible. And nobody had any idea. The kids had no idea. The kids are, in their 50s. They had no idea how Medicaid worked, how it worked if she needed to go to nursing home. So now, for the next 2.5 years, they're the caregivers
Mhm.
because
Mhm.
there's no money for her to go to assisted living, and she can't get on Medicare.
Right. And
So
it's,
you don't know
yeah.
what you don't know, but you have to think about these things
Mhm.
before you're
Mhm.
90 something. You have to,
Right. Right. And I know sometimes people might think, they might be a little resistant to, maybe spending a little bit now to get that info, or maybe to work alongside an attorney or something. But it honestly, in the long run, is worth it, because the example you just gave, not knowing that look back period, now they're in a bit of a situation that's difficult. So definitely, talking about those taboo things that we sometimes don't want to talk about, it's so important.
or I think too, like the children of seniors should be investigating things and bringing them forward to their parents. So even if your parent, is feeling uncomfortable to go to you, let's say, and talk about it, that the children, the adult children, can go and have the tough conversations and then bring them to their parents so they could say, here's what we're thinking of. I know you don't want to stick us with anything crazy, so let's discuss what your needs are for the future, because nobody wants to be a burden, but you're not a burden. You're only a burden if there's no plan. We don't know what's going on with you, or what you can afford, or what your wishes are.
Mm-hmm.
So,
and that honestly is the greatest gift, I think, that someone can give to their family, is having a plan in place, not making your family make those difficult decisions, saying, hey, I know what I want, and detailing this is what I want. And so when that time comes, whatever it may be, maybe you have some type of dementia and you're no longer able to verbalize that, but you've made your wishes clear. So your loved one can really follow your wishes and not have to sit here and think and decide, well, what would dad want? Am I making the wrong decision? So, planning and talking and all of that, it's critical. And, that's why when people do call us kind of really unsure, we give them as much info as we can, without overwhelming and without confusing, because, there's so much to it, but just trying to give some guidance, so they can begin this process and figure out, where they need to be, what they need to do. All of that good
so
stuff.
Danielle, would you be the person? I know you're the community outreach person, community director, community relations, but are you the person at the National Healthcare to reach out to if they have questions? Or
Yes, feel free. That's my cell up on the screen, so feel free to call at any time. I'm happy to help and answer any questions, and point you in any direction. If it's something that's a bit out of my wheelhouse, yes, I know basics on kind of, insurance coverage and Medicare and Medicaid, but I would certainly, refer you to someone who could answer all of those questions, with 100% accuracy, whether it's our admissions director, our business office, director. So, I'm happy to kind of use me as a middleman, and I can definitely get you in the right direction.
all right, that sounds great. So if anybody has questions on anything, like what to do next, what to do for Medicare, Medicaid, how they could use their long-term care plan, what they should do with their spouse, what they should do if they inherit money, whatever their questions are, they can call you, come to you first. You'll steer them in the right direction and help them get the services that they might be entitled to or need.
Absolutely.
So that's fantastic.
Absolutely.
Thank you so much, Danielle.
Thank you.
And in closing, would you like to tell us anything else about yourself or the agency and what's going on with them?
Let's see. Yeah, I mean, definitely. I do just want to, I would like to mention, I think there's this kind of stigma, and this around aging and, thinking I don't want to go to a nursing home. I don't want to leave my home. And I think, we're slowly breaking down those walls and that stigma. Being in a communal type setting has so many benefits, activities of daily living, quality of life activities. Someone who is homebound, maybe their religion and getting out to mass every week was so important and they can't do that anymore. But if you're in a different type of setting where it's a, community, where there's people around you, you can go to mass at the facility. Someone can come and bring you communion, or maybe someone, could benefit from an assisted living who says, like, I'm just kind of done upkeeping my lawn and paying someone to mow and, maybe cooking, so there is that piece of like quality of life that we can give, and that that community that reduces isolation, because you're not alone. You have your own little space if you want to go to your room and do whatever you want to do. But being at home alone can be isolating. Being at home with, being at home with, a companion a couple hours a week can still be very isolating. So I think that's the one piece that people miss. And we still are just like, that mentality of like, I don't want to go to a nursing home, but it's so not what it was. I mean, they're so beautiful and comfortable and home-like. So I encourage you, stop by, take a look for yourself, ask your questions and just inform yourself. But yeah, I think that's an important thing to share, because
I 100% agree with you. And I think that children of seniors have such guilt about moving their parent from their home that they've been in for maybe 50 years. I'm trying to move my own mom, and she's independent, and I want to move her to one of these, hotel type places in Connecticut, because she's becoming very insular in her mid 80s. And I could see it. She knows it too. And, you're going to thrive better being socialized. And I notice it even with our little home with memory care. We have people that had 24-hour care at home, and a lady came to us and said, it was so boring. Just me and the caregiver, just the two of us every day. Like, it was so boring. And so even now, even if they just sit and are among a handful of other people, it's interesting. It's exciting. It's something else. They're dressing up for it. They're like looking forward to it. Nothing exciting has to be going on, but they're just with others, and it's just more stimulating. And it was boring and lonely to be at home. So even though you think you're doing your parents a service by keeping them in their home, that might be great when they're still independent and they have friends around them or family or neighbors. Like my mom, most of her friends are dying off. And pretty soon she'll just be in a big house by herself. And what's so fabulous about that?
And perhaps when someone stops driving and they're no longer able to get out and visit, or just even go to the grocery store and interact. Definitely, like you said, the word thriving, I think, is, a great word to use, because, someone really can, you can watch them thrive in this setting where they can socialize and engage and do things that they love. And, their mind is stimulated with activities. And, there's so much of benefit to these settings, as well as, and again, it's individual to the person. It's what works for them. So maybe that type of setting isn't the best for them. Maybe home is really a preference, but just know there's benefits,
Yes. I also think that a lot of people want to stay at home because that's familiar and what they know, especially when they get older and afraid. And
of course,
especially if memory care sets in, it's what they know. So it's what they want, but it doesn't mean that's the best for them.
Well, we also encourage, if someone's, moving to us long-term, memory care issues or not, make your room your own. If you have a favorite comforter, a hand knit Afghan, pictures, pictures of family, pictures on the wall, bring in your, comfortable, reclining chair. So we 100% encourage that. We help with that. Like, make your room your own. So yes, it might be a little smaller than what you're used to in your home, but when you walk into that, it feels like home. It's familiar, and that's someone with dementia or not. Even someone with dementia can walk in and it can feel comfortable and it can feel familiar.
Well, thank you so much, Danielle. I really appreciate you coming on the show and sharing with us all the continuum of care and everything you have to offer at the National Healthcare Southern Connecticut chapter. You are a wealth of information. So if anybody needs information on anything senior, call Danielle at 203-247-7840. She really knows her stuff.
Thank you so much. I appreciate it.
We'll talk soon.
Thanks. Take care.
Bye. Wow, she really does know what she's doing. And 20 years, she looks 20 years old, but 20 years she's been in the business. Danielle, 203-247-7840. It can be so overwhelming. Just Medicare or Medicaid is overwhelming. Just to know what to do with your finances is overwhelming. Just to know how anything works, your benefits are overwhelming. To get out your long-term care insurance and brush it off and dust it up and see what your benefits are. I have a woman living in my place now who's 93 who hasn't taken advantage of her long-term care benefit yet. I'm like, I don't know what she's waiting for because she's 93. So just knowing what you have, what you need, and resources to get it is ideal. So thank you so much, Danielle. And thank you everybody for being here and listening. And as usual, it's Deirdre Verbo signing out saying, be well.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.